will have seen that the COVID pandemic clearly is not over yet, with civil unrest in Europe over new restrictions, WHO warning of 5 million excess deaths likely, and also the IMF warning of huge losses to the world economy if we don't vaccinate the world quickly, in the order of about $5.3 trillion. Well, it was almost 6 months ago since the International Panel for Pandemic Preparedness and Response presented their findings and recommendations to the World Health Assembly. And their main report was published soon after that. And if I could just quote one very important quote, I think, from the summary of the report. They said the independent panel has found weak links at every point in the chain of preparedness and response. Preparation has been inconsistent and underfunded. The alert system was too slow and too meek. The World Health Organization was underpowered. The response has exacerbated inequalities, and global political leadership was absent. So very, very strong messages from the panel about the state of the world coming through COVID. Now, the panel and the Commission made a number of series of recommendations around tackling this pandemic, and also some longer-term recommendations for future pandemics. And most importantly, they said the world needs a new international system for pandemic preparedness and response, and needs one fast. Since then, we've had the G7, the G20, the United Nations General Assembly, so there have been plenty of opportunities for world leaders to act. So how is the world performing in ending COVID-19 and creating this new international system for pandemic preparedness? And is it acting fast enough? Well, to address this question, the IPPR has produced a 6-month accountability report to assess progress against each of their recommendations. Their report is called Losing Time, End This Pandemic and Secure the Future. So I think there's some indication there about what the view is about how we are doing in acting quickly. But who better to tell us about the report than the two co-chairs of the report, who will be joining a panel with two distinguished respondents to discuss the implications. I should emphasize that this meeting is on the record. It's not following the famous Chatham House rules. And so quite the opposite. We very much encourage you to tweet and spread the messages amongst your followers. We will also be asking for questions and answers to the panel. And if you can use the Q&A function at the bottom, don't use chat, that's disabled. But if you use the Q&A, that will give you an opportunity to ask a question and even potentially come on mic, as it were, to pose your question. So immediately, if I can introduce our panel today, and we are absolutely delighted to have with us the Right Honourable Helen Clark, who's the former Prime Minister of New Zealand and one of the co-chairs of the IPPR. We also have Her Excellency Ellen Johnson-Sirleaf, who you'll know is the former President of Liberia, Nobel Peace Laureate and member of the Elders, and who is one of the other co-chairs. She will, in fact, be giving us a video contribution, because unfortunately she's on a flight at the moment, very kindly sent us a video message over yesterday. And then we have two respondents who I think are working for organizations, institutions very much at the front line of the response to the COVID pandemic. So we're delighted to have with us David Miliband, who is the President and CEO of the International Rescue Committee, and of course is a former Foreign Secretary of the United Kingdom, and Zane Dangor, who is the Special Advisor to the Minister of International Relations and Cooperation of the Republic of South Africa, and also is chair of the ACT-A COVID-19 Vaccine Manufacturing Working Group. So very much involved in the issues around vaccine equity. But I'd like to start, please, with this short video from President Johnson-Sirleaf to begin to introduce the report. So if we are to bring on the video, please. Fantastic, thank you.
Thank you, Rob Yates and the team at Chatham House for hosting the release of our progress report today. 6 months ago, Prime Minister Clark and I presented the main report of the Independent Panel for Pandemic Preparedness and Response to the World Health Assembly and the world at large. Our report was the product of months of meticulous analysis of the international response to COVID-19. We were privileged to work with 11 distinguished leaders to deliver it. We recommended a comprehensive package of reforms to ensure equity, to leadership and governance, to finance and legal instruments, and to strengthen the WHO. Action on this package as a whole is vital to stop the current pandemic and to stop a future health threat from devastating the world as COVID-19 has done. We are encouraged to see some movement to address some of the major gaps exposed in global pandemic preparedness and response. There are conversations happening in many of the right places, but the world is not moving with the speed this moment requires. In the past 6 months, 90 million more people have contracted COVID-19, and more than 1.6 million people have died. Those are only the reported cases. Waves of disease and death continue. The resolve to maintain protective measures is waning. Vaccine coverage is uneven, and people in the poorest countries still have almost no access to vaccines at all. The world is losing vital time against a virus that continues to thrive when we don't work urgently together. It is over a year since the first results showed that COVID-19 vaccines were effective against severe disease and death. Today, over 2/3 of the entire population of high-income countries are fully vaccinated. This contrasts harshly with the situation for poor people in low-income countries, where an average of fewer than 1 in 20 has received a single dose. Our panel calculated there were at least 1 billion doses available to redistribute to low-income countries by 1st September this year. Yet, while wealthy countries have made impressive public pledges, just 256 million redistributed doses have actually been delivered through COVAX, as we recommended. This is compounded by inconsistent delivery, a lack of transparency, and even dumping of nearly expired doses. These practices waste a vital opportunity to save lives. WHO estimated that up to 180,000 health workers have died from COVID-19 while caring for us and our loved ones. Many of these people lived in countries without enough doctors and nurses to begin with. The idea that a poor health worker is unprotected while the healthy and wealthy receive booster doses should present a deep moral quandary. To this, there is only one solution: vaccine equity. Countries must also make use of the full range of tools available beyond vaccines to manage COVID-19. It's a vaccine plus strategy, and it includes equitable access to diagnostics and novel antivirals, in addition to masking, distancing, and ventilation as the epidemiology demands. COVID-19 has demonstrated the urgent need for leader-level multilateral action to respond to both the current pandemic and to prepare for the next health threat. These health emergencies extend well beyond the health sector into finance, trade, labor, education. The list of affected sectors is long. Pandemic preparedness and response demands a whole of society approach. This is what we called for in our report. Specifically, to catalyze change, we call for the heads of state and government to attend a special session of the UN General Assembly. There, they would agree a political declaration that would provide a roadmap to end pandemic and avert another. The Global Preparedness Monitoring Board has echoed our call for a summit at that level alongside many other international actors.
Thank you. Thank you very much, President Johnson-Sirleaf. I hope you'll be watching the recording at some time, and we really appreciate your contribution there. And if I can maybe hand over now to the Right Honourable Helen Clark, who of course is one of the other co-chairs, if you can sort of pick up the story, I think maybe looking at some of your key recommendations. So Helen, over to you.
Thank you, Rob. Are you hearing me now?
Perfectly, yeah.
Right. Well, thanks, Chatham House, for hosting, and following on from where Ellen left off. Let me say a few words about what we see as having happened and not having happened in the past 6 months, and what we think needs to happen fast. Our panel did urge that action should be taken on our recommendations as a package, because we felt that a transformation of systems for preparedness and response was required. And at the very centre of our package was this Global Health Threats Council, which we said has to be led by heads of state and government who have the gravitas at the global level to drive change. Now, we have, of course, been very encouraged by support for the concept of the Council from a number of quarters. The G20 high-level independent panel backed it, and very senior presidents, including President Joe Biden and President Cyril Ramaphosa, have also backed the concept of the Council. And we think if such a Council was created now, it really could galvanise action on pressing issues of right now, like vaccine equity, but also for working coherently towards reforms that would enable us to avert another devastating pandemic. We think that agreement to form the Council could be one of the actions which comes out of a UN General Assembly political declaration agreed by leaders at a summit at the UN. And on convening such a summit, we're also seeing encouraging voices from, for example, the Global Preparedness Monitoring Board with its most recent report. And I could also say we're very encouraged by the traction that is being gained in New York now in support of convening such a summit. We're also clear that an authoritative and independent WHO is a key part of a reform package. It has to be the nerve centre of all health aspects of pandemic preparedness and response. But it needs to be stronger, with true independence, and with the focus, the authority, and the reliable financing to do the job member states expect of it. Now, since our report, the World Health Assembly has set up 2 working groups. They're addressing the independent panel's recommendations and those of other reviews. And we have 2 forthcoming summits of the World Health Assembly. The one beginning next week will focus on the question of new legal instruments, which could be a new pandemic convention, as we recommended, and could also be changes to the international health regulations. We concluded that the regulations were more of a hindrance than a help to the WHO in trying to fight the pandemic. And just on the issue of where the existing legal arrangements really have fallen a little short, I would recommend the paper based on the chronology of how a localized outbreak became a global pandemic, which was put together by our staff of the Secretariat. That has now been turned by the staff into a paper, an analysis published in The Lancet. And it does point to areas where new legal provisions could fill gaps in existing international legal arrangements. I think a key message to member states meeting at the WHO next week is, please act. We're still in the middle of a pandemic. We can't shrug it off. This is not something that needs to be debated endlessly. Please get on with it. Get on with the negotiations for the treaty. We said it could be done within 6 months. People thought that was ambitious, but we drew on the Chernobyl precedent of within 5 months of that tragic accident, there were 2 new conventions achieved. So that could be a gold standard for speed in putting something new together. Now, on financing, our new report underlines that governance without finance lacks teeth, so the Global Health Threats Council needs to have a role in directing finance, but finance without governance lacks accountability. And we are not alone in assessing that at least 10 billion a year is needed for low-income countries to be able to advance pandemic preparedness to a satisfactory standard. But we're not yet seeing the political will coming out of, for example, G20, which does represent 85% of the world's economy, to move on this. Contrast this with the leadership G20 gave in responding to the global financial crisis of some 14 years ago. The last G20 summit simply resolved to establish yet another task force to explore the issues around financing, which we think is extremely disappointing. And we would suggest now that an inclusive coalition of fast mover countries should get in behind the calls for a financial intermediary fund and make the financial commitments required to reach the projected goal of $10 billion a year. And the World Bank could immediately signal its willingness to host the facility. But let me stress, over time, we think this facility should become one that is based on an ability to pay model rather than on a charity model. We think that pandemic preparedness and response is clearly a global public good, that the donor model hasn't worked for this pandemic, it won't work in future. We need a sustainable formula-based approach to global public investment in this area, and we do think the Global Health Threats Council should play a role in directing the allocations from the facility. Now, again, on global public goods, there has not been an equitable supply of tools to fight the pandemic, as President Sirleaf underlined in her comments. And while there's obviously been a lot of talk about the vaccine injustice, many countries have also lacked proper access to other basics, from diagnostics to therapeutics to oxygen to personal protective equipment. We have on vaccines seen some movement on broadening the base of vaccine manufacturing, with plans, for example, for manufacturing in Africa and Latin America, and the voluntary license agreements to deliver the newest oral antivirals to selected countries is clearly a step in the right direction. But most countries around our world would like to see a TRIPS waiver during the pandemic for vaccines, diagnostics, and other key supplies for the duration of the pandemic. And we support that because, put bluntly, global public health shouldn't be held hostage to manufacturers who purchase patents, many developed with public money, to spin into profit, with wealthy countries then willing and able to pay top dollar for the products and buy more than they need, thereby excluding others from getting the access they need. So we think that looking to the future, the Act A COVAX type platform needs to be transformed into something which is truly end-to-end, with agreements and modalities to deliver pandemic tools as global public goods. So that's a bit of a summary of where the world's come in the last 6 months, a lot more detail in the report. But to summarise, the next 6 months, what would we like to see? We'd like to see that summit convened at the UN to agree on the political declaration which sets out the roadmap for the reforms needed to the global architecture and has as its centrepiece the Global Health Threats Council at the head of state and government level. We'd like to see the World Health Assembly now put its foot on the accelerator to negotiate the new legal instruments, and we really have hopes that this will happen from the meeting next week in Geneva. We hope that the working groups working towards the May session of the World Health Assembly again will step up in designing the more authoritative and financially secure World Health Organization. We would like to see that fast mover group of countries now coming behind a financial intermediary fund, which, as we say, should be redesigned in good time on a global public goods model. And of course, the vaccine gap just has to be closed. We can't get out of this pandemic while we leave so many countries behind with such a terribly low rate of vaccine. But let's also stress, and this is very relevant to the state of the pandemic as it waves again through Europe at the moment, it has to be a vaccine plus strategy. Vaccines can't do the job alone. And all the non-pharmacological measures relevant to the state of an outbreak at a particular time just have to be deployed. Otherwise, this virus is going to slip through every crack that it can. So, some things moving along, other things need a lot more urgency. And our call really to member states is get cracking at the World Health Assembly sessions, get cracking in New York around a summit for the reform architecture. We could make this the last pandemic, and we could end this one a lot faster than the track it's currently on. Thanks, Rob.
Thank you very much indeed, Helen. Yes, a real cry there to get cracking, both to sort this pandemic out and to avoid future ones. And if I may bring in our discussants now to really reflect on the report. And David Miliband, you're part of the panelists, who have been working on the IPPR. And also IRC is really much at the front end of a lot of these processes, trying to provide health services in some of the most deprived parts of the world. What's your take on, how the world is tackling this pandemic and what should be done with more urgency?
Thanks very much, Rob. I'm pleased to be with you. I'll zip through some remarks rather quickly because, as I think explained, I have to depart in about 15 minutes. I'm very pleased to have this opportunity, and I think it's an important event because my sense of urgency about the reforms that we proposed in May is exceeded only by my sense of frustration about the lack of progress since May. Over 5 million people are dead as a result of COVID. The global economy has suffered a multi-trillion-dollar shock, and we're now in the absurd situation of countries in Europe returning to lockdown because of an anti-vaccination movement at a time when the countries where we work, the International Rescue Committee, have vaccination rates of less than 5%. And this is a comprehensive global failure. There's been an inadequate, in my view, I'm speaking for myself, I should say, an inadequate collective global leadership response, especially around aspects of system reform and financial mobilization. And I want to speak both to the prevention of future crises, which was the focus of the IPPR's report, and the current crisis. The lack of progress on systematic reforms over the last 6 months is, to me, genuinely alarming. What more do we need than a global pandemic to shock the world into making changes that have been recommended by successive reports over the last 20 years? Ideas for reform are basic. WHO financing that is predictable, reliable, and independent. The global pandemic leadership, and there's a question in the chat about the Global Health Threats Council. The critical insight of the Kikwete report in 2016 after Ebola and our report is that pandemics are not just health issues. That's why there needs to be cross-governmental leadership and why we recommend a Global Health Threats Council, not just within the WHO. Obviously, the WHO is central, but pandemics are more than health issues. Also, reforms in respect of preparedness and response funding for the future have not been brought forward. And I want to, at the risk of being controversial, point out the grotesque, really, failure of the G20 to come up with significant reforms. I was also frankly disappointed by the UNGA meeting this year. And Helen has rightly spoken about the central role of the World Health Assembly. There are always, and I can speak about, Helen knows this well from her career in politics, there's always a dozen reasons not to do something, or 2 dozen, or 3 dozen. And in this case, there are countries and actors who oppose international arrangements out of fear of transparency. There are others who are so concerned to make cooperation as inclusive as possible that no proposal is ever comprehensive enough. And then there are those who fear that anything done outside the WHO will somehow undermine the WHO. I don't agree with any of those positions. And interestingly, the advocates of those positions don't agree with each other, but in a peculiar way, they reinforce each other. And the result is that reform gets crowded out. And that is why we made a point in our May report of highlighting 11 separate reviews in the last 20 years, making sensible recommendations of the kind that we have reinforced, but they've been blocked by various parts of the system. And COVID is the warning that we shouldn't allow that to happen again. And if there is one argument I want people to remember today, it is this: the reforms we need to keep us safe for the future are the very same reforms that we need to make faster progress in addressing COVID today. The establishment of a leader-level governing body with links to a lean financing mechanism is not just part of building a better tomorrow. It's actually a critical strategy to delivering on commitments to supercharge COVID response today and to address the global inequities that you've rightly highlighted. In the high-stake race that pits vaccines against variants, ad hoc accountability, unpredictable funding is just too risky. And with the current lack of decisive movement over the last 6 months, I think we need to think about a change of approach to stimulate more global reform. And that is, countries who are willing to work together should put in place elements of longer-term reform now. They should be encouraged to get on with it. For example, if countries like the US, South Africa, Norway are ready to support a Pandemic Preparedness and Response Fund, they should be encouraged to set it up. If they're ready to nominate a chair of the Global Health Threats Council, as we called on the G20 and UNGA to do, they should be encouraged to do so. While continuing to seek consensus and maximize inclusion, we need mobilization that a group of first movers could provide. And at the moment, inertia and stasis are the more likely outcome, and that is very, very costly, especially for the most vulnerable in the world. I'm really looking forward to the contribution of our South African colleague here, because South Africa has played a key leadership role in developing a truly global view of this, both within and beyond the UN system, and obviously knows from its own situation the cost of inequity and the cost of inertia. I hope that these discussions today, and I do apologize I can't stay for them all, will help us converge on what I would call highest common factor reforms that are urgent and necessary and that chart a realistic path to global reform. Succeeding in the next 6 months, where we have frankly failed in the past 6 months, means steering around the forces of inertia that are arrayed against any type of reform and pragmatically avoiding the trap of making the perfect the enemy of the good. At the moment, we're not good enough and we need to do better. Thank you.
Excellent. Thank you very much indeed, David. And then we do understand that you have another commitment in about 5 or 10 minutes, but hopefully we'll be able to hear the contributions of Zain. And you're absolutely right about South Africa being pivotal, both in combating the pandemic on the continent of Africa, but in these big discussions around access to vaccines and the WTO and patent waivers. So we're dying to hear from you, Zain. You know, what's the view from South Africa about what we should be doing and doing it faster?
Thank you, Rob, and also just to thank the team at Chatham House for hosting this panel and also for inviting me. I must say it's a real honor for me to be on this panel with President Sirleaf, Prime Minister Clark, and David Miliband. Both President Sirleaf and Prime Minister Clark have succinctly outlined the package of reforms that they've recommended in their report 6 months ago, which sought to ensure that gaps in the capabilities and the capabilities of the global community to respond to the COVID-19 pandemic, but also, as David has pointed out, to future pandemics were addressed. But if you read through that package, what undergirds it is actually the principle of equity between countries. And I see there's a question in the chat around what is equity, and is there a common political understanding of what equity is, and perhaps that could be taken up for discussion. Again, both co-chairs and David have addressed what needs to be done now, 6 months after the first report was released. And they've also spelled out the cost to health, lives, and livelihoods of millions of people across the world in the face of continued inaction, inertia, or blocking of discussions. So, coming to South Africa, and what the approach that we take is the government of South Africa supports the recommendations emanating from the first report, and the calls for the implementation as outlined in the report that we're launching here today. This includes the call for a more responsive global health architecture with a Global Health Threats Council that is led by heads of state and government, as David and others have pointed out. But we also support in both reports the call for a strengthened World Health Organization and a Pandemic Preparedness Treaty to secure and the report uses very good language, and I'd like to underscore that language, to secure the collective interests in pandemic response measures. And the idea of collective, which implies multilateralism, which implies solidarity, is something that we support very strongly. And within that, we strongly include, within that collective response, equitable access to life-saving vaccines, therapeutics, and diagnostics. And I'll speak a bit more about that. But we also support, as others have pointed out, a mechanism for better pandemic preparedness financing. We were one of those parties that just argued that, we need to set this up quickly, but we also need to ensure that we bring developing countries on from the outset. So you might have a group of lead countries taking the lead, and that's important, but you need to ensure that we bring on board those developing countries in the discussions and governance as soon as possible. And perhaps that's something we can discuss as well, but we do support the need for such a fund, whether it's, we haven't really spent time on what the nomenclature is, but I think the idea of this particular fund is important. As indicated by David in particular and others, that, since May of this year, 90 million people have been infected with COVID, 90 million additional, right? And then you also had approximately 1.65 million people that have died of COVID-related complications. But that is linked, and the report points this out, it's linked to the increased vulnerability of regions where vaccination levels are low, but low due to having no access, not low due to vaccine hesitancy or other reasons, but really access as the main driver of low vaccination rates. And you can see in the report that the vulnerability, including rates of infections and mortality, is linked to regions where vaccinations are particularly low. So 6 months ago, the co-chairs and the fellow panelists called for voluntary technology transfers, and Prime Minister Clark spoke about that. But they also stated, if voluntary technology transfers do not take place, then a waiver of trade-related aspects of intellectual property rights must be implemented to ensure a better global response to the pandemic. Well, to the co-chairs and the panelists, the voluntary sharing of technology transfers have been slow. Major companies have been reluctant to transfer and share their technology with, for example, the mRNA Technology Transfer Hub that was established by the WHO under the auspices of ACT-A in South Africa, and a similar hub has also recently been established in Brazil and Argentina. So instead of partnering from the outset with the medicines patent pool of the WHO to facilitate technology transfers, and we're seeing some dialogue taking place now, which is very useful. But we saw instead a preference for bilateral partnerships where issues such as ownership of the IP are more uncertain, if not opaque. And I stress the importance of the multilateral established hubs as they seek to address the fundamental issue of security of supply of vaccines. And security of supply is sort of delinks the preference for philanthropic approaches. And I think Prime Minister Clark pointed this out. Security of supply just means it's reliable, it's predictable, and it's done in a manner that does not repeat the vaccine nationalism that we've seen in this pandemic. It's in this context that a decision on the waiver as proposed by South Africa, India, and supported by over 100 countries must be given prominence at the next Ministerial Council of the WTO. And if Prime Minister Clark does not mind, if I can just repeat what she has said, a global public health should not be held hostage to very few manufacturers who purchase patents for profiteering purposes, and also in a situation where high-income countries have pre-purchased these products at premium rates, but have done so in a manner that created a scarcity in low and middle income countries. I think that's worth repeating, Prime Minister. And again, I think given these contexts, we call on those who still block the waiver to revisit the reasons for such resistance and look at the package that the IPPR has put forward and locate voluntary tech transfer and the importance of voluntary tech transfer within that. And if that's not possible, then we should move with speed on discussions on the waiver at the next Ministerial Council. You know, David spoke about the G20. I was part of the Sherpa meeting of this last G20 meeting. And it's astounding that we could not get delegations to agree on trade and health rights to be discussed at the upcoming ministerial conference. And we suspect the real reason for that is to block any discussion on the waiver, as the premise of the waiver is that access to medicine is a human right and it's a health right. Yeah. So I would want to conclude by just re-emphasizing the points that others have made, that the vaccine plus strategy is vital. That non-pharmaceutical measures in conjunction with vaccines, therapeutics are critical to saving lives. Thank you. Rob, I think we can take some of the other issues in discussion. Thanks.
Thank you very much indeed, Jade. And thank you so much for emphasizing the importance of access to vaccines and medicines. And of course, South Africa was really at the forefront of the battles to get ARV medicines into Africa back in the day, and it's got a great track record in improving access to medicines. And I'm sure these are going to be some of the topics we're going to be picking up now in the questions. As usual at this point, I'm sort of pleading with people to put questions to us, but they're swarming in today, so that's no problem at all. And in fact, we're already inviting some people on mic to pose their questions, and so I'll just go straight to them. Really, we'll try and get through as many as possible, but if you can keep your questions quite quick, please. So if we can start with Tony Costello, please. Tony.
Am I muted still?
No, you're good.
Right. Well, to some extent, my questions have been answered by David and Helen, and I congratulate them on their report. And the issues around assessed contributions, nothing has changed. Having an independent scientist or a global health security panel, nothing has changed. Mobility of staff into regional offices at WHO, nothing has changed. These are all diplomatic issues. But when we come on to vaccine deprivation, I'd just like to contest one fact that David said 5 million people have died. That's in the official statistics. The Economist estimate it could be as high as 18 million. What we do know is that in India, for example, where the official figures are 450,000 or so, that the true figure is probably 10 times that, based on a number of studies looking at cremation reports and the like. So I think we've got to come off the fence here and say, you know, the US, France, South Africa, India, Eswatini all supported a patent waiver. So it had Biden support, Macron support. Germany, Canada, the UK blocked it. And Bill Gates, who has used his charitable position to adopt an overtly political line. And I have to say, I would call this econicide. This is supporting an economic viewpoint of free market economics that is depriving millions of people of life-saving vaccine. And this will run for years and years. I think this is a criminal act that should be challenged in the international courts. And I'm absolutely, I'd be interested in Helen's views on that, because it has rippled out into the climate change scandal of not funding loss and damage to poor states. So unless we get this right, we're in a very grim future.
Thank you very much. So Helen, if you could take that on, please. You really the human rights aspects of this, and are we talking about this disgraceful vaccine inequity in effect being sort of a crime against humanity?
Well, we have the tools to fight this pandemic, and they're systematically being denied to a significant proportion of the world's people. So I certainly endorse the thrust of what Tony is saying. In my humble opinion, rather than having to negotiate a TRIPS waiver every time a huge global public health threat like this emerges, you should have a standing provision that the IP rules go out the window when you have to fight a pandemic. Now, eventually, they went out the window for the HIV antiretrovirals, but we're having to do it case by case by case. We need some kind of trigger that says when there's a disease outbreak at scale, you can't just hoard the patents and take the profits. You've got to get these global public goods out there. So that's why we've called for support for the TRIPS waiver, but I'd go further with the standing provision, and also called for a fundamental redesign of the ACT-A COVAX concepts so that they're based on a global public goods with global public investment model, not a market model.
And Zane, have you thoughts on that from South Africa? Because you're really on the front line on a number of these issues.
Yeah, I think the proposal that we put forward was as an emergency waiver for the duration of this pandemic, but we are clear that this should be a standing provision, that negotiations must be one that clearly deals with future pandemics and future threats to global health, and that the manner in which we agreed to this in Doha 20 years ago has led to a situation where a few companies can actually profiteer in the manner that they are doing. So we are, hoping that this leads to a more long-standing discussion and negotiations about changing the TRIPS language in a manner that lays the basis for not having to go back every single time to do a waiver. And just the difficulties that we have is that the particular manner in which this temporary waiver has been blocked gives you a sense on the difficulties for more permanent negotiations on the issue. I think that Anthony's point also about the potential crimes issues is something that we've discussed in South Africa, not in formal ways, but in civil society and their engagement with government. If you look at Article 7 of the ICC's statute, and there is an argument in some circles that this must be investigated in more depth. So Anthony's got a point there, and the access debts. Even the access debts in South Africa. I mean, we have our medical fraternity actually looking at the fact that it's more than double the official reported deaths. And that's happening in South Africa, it's happening in most other parts of the world. So, the mortality rates are much more than we're seeing in official statistics, which just lends to the gravity of the issue. And if you look at the ICCT and its key principles, gravity is a major issue that determines whether an issue should be of concern to the global community. So I think Anthony's got a very strong point there.
Exactly. What one wonders what it is going to take to get leaders to take this seriously. And when you do have situations, so the UK, I believe, disposed of 600,000 doses of the AstraZeneca vaccine in August because they've expired and thrown away. And that just seems phenomenal that that's allowed to continue. If I could bring Elisabetta on, please, now. Elisabetta, if you're still with us, thank you for being so patient. And I might have time for a couple more, but so Elisabetta, would you like to come on mic?
Yeah, sure. Thank you very much. Thank you very much for convening this event. And my question is for the international panel co-chairs, but for now it's only for Right Honourable Clark. So my question to you is, if you could please clarify why the Global Health Threats Council should be hosted by the UN and not by the WHO, considering that the panel has advocated for a strengthened WHO. Thank you.
Yeah, the quick answer is that pandemic preparedness and response is about far more than the health sector. I think in a way we've seen WHO almost left to fight this pandemic on its own. This needs coordinated action across the multilateral system. And that's why we haven't recommended that it be a leader-level council associated with WHO. It should work very closely with WHO, and its work would be very supportive of the role of WHO. But it also has to link to the international financial institutions and other key bodies associated also with pandemic response. So that's the reason. We have said in the report that we think it could usefully be headquartered in Geneva, where you have a lot of relevant agencies, including Gavi and including the Global Fund, which has played quite a role this time, CEPI, and of course the Centre of the World Humanitarian System is there. But we don't think it should be a standing body of the WHO.
Thank you very much, Steve. Helen. Maybe you can go to Annika, please. Annika Schneider.
Hi, everybody. Thank you for such an engaging conversation. My name's Annika. I'm an Associate Fellow at Chatham House. I should declare my interests. I'm also Research Director at the Reform for Resilience Commission, Helen, which I'm sure you're aware of, and former WHO staffer during the Ebola outbreak. So I'm going to ask the question from that perspective. I think the IPPR report is quite amazing, but one of the tensions that I see in what you're proposing is that there is a need for quick action. Helen, you talked about a coalition of fast movers, but what we're also talking about, and when we talk about TRIPS waivers and global public goods, is very long-term, geopolitically driven discussions. I think there's been a lot of things during the pandemic which are worth noting if you consider that COVAX is virtually like an international startup. That gives it quite a different perspective. So what I wanted to ask was, beyond the proposed policies, global policies and agreements that you're talking about, is there a range of options that can be considered by, for example, the coalition of fast movers that can be adopted, which will complement these longer term discussions and processes? I think there's room here for some nuance, and particularly if we want fast action. So that's my question.
Yeah, if we go back to the original report, we always talked about what has to be done absolutely now and the architecture reforms for the future. And what has to be done now is pretty much what we said in May. We have to scale up manufacturing. That's been far too slow. And the manufacturing countries need to exert the levers that they have on the companies headquartered there, who, after all, have produced these vaccines and goods with a lot of public money. Now, we urge the WTO and WHO to convene the manufacturing countries and companies to try to broker more agreements for scale-up manufacturing, etc. That forum's been meeting, but we need more action. We also urged the redistribution of vaccines, knowing that high-income countries had ordered twice what they needed. And, we get pledges. There were sort of pledges out of G7, and G20 didn't commit so much. But if you add up the pledges, they don't look so bad. But they're always kind of not this month, not next month, but next year. Look, as Rob said, there's wealthy countries like the UK which are, throwing vaccines down the drain now because they haven't used them. If they'd had better planning at home, they could have released the surplus doses into supporting the countries that can't get their hands on them at all. So we just need better coordination of where is that surplus. Get it out now. Dr. Tedros set the 3 dates. 10% of the population of every country to be vaccinated by the end of September. Didn't happen. 40% to be vaccinated by the end of December. Right now, 80 countries are on track not to reach that 40% coverage. And then he said 70% by mid next year. Well, if you can't reach the 40% by December, it's going to be hard to reach the 70% by mid next year. So, definitely there's things that could be done. And I'd really urge, the UKs, the USs, the others who host these big pharma, exert all the pressure that you can to get the manufacturing scale up out there and get your redistributed doses out there fast.
Great. Thank you very much. And if I could bring Olya on, who I think has got another question about the, sort of the architecture and really around where the funding should go and who should administer that. So Olya.
Thank you very much. My name is Olya and I represent Frontline AIDS. Could the honorable panelists please reflect on the advantages and disadvantages of placing a new financial intermediary fund in the World Bank? And the reason why I'm asking this question is because as the civil society, we have concern that the civil society does not have sufficient space on the governing and decision-making mechanisms of the World Bank. As always, community responses for health are not always sufficiently recognized as the integral element of health systems in the World Bank governance and programming. And if I may, in addition, to ask a bit of a controversial question, is there space for civil society on Global Health Threats Council, and can this be an equal space, similar, kind of on the equal level with the head of states? Thank you very much.
Good question, Olya.
Yes, and short answer on that last bit is that our design of the council said heads of state and government level plus representatives of science and civil society. So we're always clear that they need to sit there with equal power on the council. I think that's extremely important. But on the issue of where the facility should sit, as a panel, we didn't want to see yet another global fund set up. We've always talked about a financing mechanism which needed a host, but with the Global Health Threats Council actually taking the decisions on the allocation mechanism. Now, as I say, the G20 failed to come up with anything concrete. The US and Norway have done a lot of work on this financial intermediary fund, which they suggest be hosted by the World Bank. It could be hosted by any number of existing institutions, but accepting your point that the governance there is not particularly inclusive, we think the governance would go better into the Global Health Threats Council, but the council itself shouldn't be expected to sort of run all the fiduciary and logistics and technical aspects of a fund. That can be hosted elsewhere. So it wouldn't be making the World Bank or powerful or IMF or Global Fund or whoever, but rather having a mechanism for the money to come into, but then the Global Health Threats Council to determine the allocation from.
Great, thank you. I think we might just have time to sneak in one more question, please, and that is from Anthony Dworkin.
Thanks very much. This is Anthony Dworkin from the European Council on Foreign Relations. So your panel has made a lot of great recommendations, and there have been recommendations coming from many other review bodies as well. And as you say, a kind of failure of action so far on them. And I'm just wondering, For both panelists, but particularly Helen Clark, as a former head of government yourself, how do you assess the political reasons why governments around the world have not acted more quickly to take up these recommendations and move forward with them? Would you support David Miliband's idea that some countries should move forward more quickly? And if I can just add an additional point, if we're in a complex and difficult geopolitical environment where it's hard to get international agreement, perhaps trying to agree a new binding treaty might not be the most realistic and productive way forward, and we should concentrate more on some sort of smaller groups of like-minded countries moving ahead. Your reactions to those, please.
I think the truth is that most countries have been sort of so down to it fighting the pandemic that maybe the space for some of these bigger discussions hasn't always been there. But I am satisfied now that things are moving. I think the World Health Assembly will move on negotiations for new legal instruments. I just say don't take too long about it. Use the Chernobyl precedent and do it quickly. Secondly, I'm quite optimistic now that there will be a special session of the General Assembly. There's a lot of support being gathered for that. And then the member states need to focus on what would go into the political declaration. Obviously, we're advocating the Global Health Threats Council, but also support to the other key components of the package, which include the support for the Pandemic Convention, the financing mechanism, WHO strengthening, and the Act A COVAX redesign for the future. I'm actually optimistic that we will get movement of some kind on most of that. And I think the steps now, these two forthcoming sessions at WHA and, with any luck, the special session of the UNGA, we will get some movement, but it's taken a while.
Zane, do you have some thoughts on this issue around sort of the lack of political leadership and maybe the sort of the potential for some countries moving on, faster?
Yeah, thanks, Rob. Look, I think that as Prime Minister Clark has pointed out, the need to deal with the immediacy of the pandemic, and the devastating consequences it had on the lives and health systems being put under strain, and the economies going, under immense pressure, meant that not everybody was working at the same pace to look at these issues from a global or regional level. I think at the AU, we managed to try and push, at the AU regional level, some form of collaboration on research, on the sharing of diagnostics, and now also on procurement of vaccines and also into the vaccine manufacturing space on a regional level. So there is some kind of movement at the African Union level, and I think also in other regions. So there is this double-edged sword, is the lack of inactivity means that we are slower as the global community to respond to an emergency situation. But we are also a little wary of the idea of a coalition of the willing that moves ahead in a manner that actually leaves people behind and creates resistance for changing the global health architecture. And if you don't strike that balance, you might find that you have negotiations and discussions forever around this new architecture, with people actively blocking it because they haven't been involved. But at the same time, as being pointed out by the reports of the co-chair, the existing global health architecture is not, has too many gaps to be effective for future pandemics. So we need to move with haste, but we also need to move in a manner that brings people on board quite quickly. And I think we should spend the time on bringing countries on board and civil society on board. So, so be inclusive right from the outset, invite people so that people can engage. And I think this was the major sort of differences between, for example, proposals emanating from countries in the EU and proposals emanating from the US, for example, on a fund. The US proposal was a lot more inclusive in design and intent. So whether it's with the World Bank or not is something that we can discuss, but I think what we do need is a fund that brings together that kind of inclusiveness, but still with a kind of capacity to respond quickly to emergencies that emerge on a global health scale, such as
Thank you, Zain. And I think this is the lesson about the climate emergency as well, isn't it? The need to be inclusive, because if you leave out sort of key players, it can, scupper all arrangements. We have hit the top of the hour now, unfortunately. Yet another hour has whizzed by, and it's been an absolute privilege to be part of this event today. We've been tracking the great working of the Commission, the IPPR, right from its outset, and commend you on the report and on the 6-monthly report. I think thinking about it, it's been a disappointing year on solidarity in global health. We've seen great advances in scientific solidarity, but as the United Nations Secretary General said, that science has been succeeding, that solidarity has been failing. And despite the crystal clear recommendations, the G7 really didn't achieve much in June, and the expectations of the G20 were also dashed. But I think that we are now, as you're saying, seeing light at the end of the tunnel and greater desire for collaboration and cooperation. And let's hope that the WHO coming up next week is going to be the big, the first step. But really, this global summit does seem to be an essential step into next year to really move things on in a much more sense of solidarity. So thank you very much indeed. I think a recording is going to be available. So please encourage your colleagues who weren't able to join us to check in with the recording. And we look forward to welcoming you to future events like this at Chatham House, discussing big issues around the political economy of health and health reforms. So thank you very much indeed to the wonderful panel and to such a large audience. And we look forward to seeing you again soon. Thank you very much. Goodbye now.